looking at that as a possible retail center and assembly center for the solar panel system that we're trying to create. So what I'm doing is I'm trying to create this retraining and empowerment center. I need help with it, and that's what I'm here to talk to you about. And I'm also here to ask, do you all have any ideas, or do you all have any input? Because I'm looking at it like we've got to start somewhere. And this is what I'm hearing, from my homeless people when we did do a sample survey, is that they would be 80 out of 100% of them were more than willing to take advantage of any type of training that they could get. So that's what I'm trying to do. And in the meantime, operating these two systems, the two living spaces around them, what we're calling it is living, learning, earning. So that's the system that I'm up to here, and that's my story.
Mm-hmm.
Yeah, Beth.
Valerie, I think if the majority of people here would come and visit you, you haven't really told us where you're located.
Mm-hmm.
It would be absolutely essential to them to get with the program. And I think that all they need to do is drive up 41 to where you are located. And if you could organize something where people could come in groups maybe that are small enough for you to handle.
Yeah.
We would be so motivated. That's what motivated me. After meeting you, I wanted to go up there. I've never really learned exactly where Newtown was until I drove around with you and you showed me where everything is located. So I think a map and a tour would be essential. We could get people tonight to sign up for a tour. We just need to get people up there.
Yeah.
You're here. We are hearing you. Our hearts are in the topic, or we wouldn't be here tonight.
Yeah.
The next step is actually going up there, meeting some of these people. When I was visiting Vallerie, at least 5 homeless people came over to her at the moment, and they all introduced themselves to me. They were all very gracious. They were just very cozy with Vallerie. She is such a warm, cozy person.
They're looking for worth, Beth.
Oh, they're wonderful.
They're looking for worth. They're looking for a way to participate,
yeah.
And it's all about meeting them where they're at, not where you want them to come or where you're
Right.
at. It's meeting where they're at, and giving them the opportunity to take a path to sustainability. It's all about meeting them where they're at. So Wayne, would you mind coming up and giving some perspective on how things sit with the county and the Come As You Are shelter and the direction that we seem to be headed in?
Good evening. I'm Wayne Appleby, Director of Homeless Services for Sarasota County, and I cannot tell you that how impressed I am with Vallerie and her efforts. I see folks in my profession that run agencies, have ideas to homeless solutions, but it's all about what they want to do and their model. Vallerie is really an individual who says, I want to do what works. Help me understand what works, and she's willing to change. What I'm passing out is 12 recommendations that Dr. Marvitt gave our community. And Dr. Marvitt met with Vallerie very early on. And Vallerie was very open to his number 1 recommendation, which was changing our culture from enabling to engaging. And basically, really, there's no one to blame or at fault, but we had no homeless system. We had no coordinated system in Sarasota County about how we deal with a homeless person or how do we deal with a homeless family. If one of us had a medical emergency right this moment, every one of us know where we would be in probably 15 minutes. We all be across the street at Sarasota Memorial Hospital. If you came in contact with a homeless individual or a homeless family, where would you tell them to go? There is no place. Nobody knows. Law enforcement at 3 o'clock in the morning behind Walmart have no place to send them. So our community, with the lack of any system, what they did was everybody saw a need and they said, well, that looks like a need, we'll go ahead and fill that. But there was no coordination with anyone else. And so you heard by Vallerie's own story. She came here, she started providing through her own finances, giving goods and services to homeless folks without any accountability, without having that being received with the opportunity to move yourself to a better place. But what did she do? She changed. She listened to the model and she said, I want to put my heart with my brain and let's do this the right way. And what she just described to you is, yes, it's a place where homeless folks can have a place to stay, which is the most important thing, but it's also a system that will help them move to sustainability. And that's really what Dr. Marvitt's 12 recommendations are. And I just wanted to give you a quick update. I won't talk about all of these. There are 12 recommendations. 6 of them are complete or substantially complete. If all you did was read the media in the last year about the homeless discussion and Dr. Marvitt, you only heard about the adult come-as-you-are shelter and the city and the county not getting along and that progress stopping. There are 11 other recommendations that have gone fabulously and are being worked on, and 6 of them are complete or substantially complete. A couple that I'd like to highlight is I just described what essentially was an emergency room for homeless families and children. You know, where do you direct a homeless family when you find them? His second and third recommendation was to create what he called a family intake portal, i.e. an emergency type room for homeless families. One in North County and one in South County. Because while a number of surveys were done, and we looked at 6 different data points, if you look at single adult homelessness, any of the 6 data points had approximately 75% of all of the adult single chronics are within the borders of the city of Sarasota, leaving about 25% in the other municipalities in unincorporated Sarasota County. And so when you average the 6 data points out, that's where the numerical spread came. However, when you looked at families and children, it was a 60-40 split between 60% of the families that are homeless are north of Blackthorn Point Road, and 40% are homeless south of Blackthorn Point Road. However, that puts a per rate at a higher rate in South County, and so he recommended an emergency intake portal in both North and South County. We coordinated with a number of the foundations, a number of social service organizations, and Harvest House was identified to open the family intake portal. It's called Harvest House Family Haven. Had their ribbon cutting on September 29th. They opened up on October 1st to accept their first family. They have 3 units for emergency housing, and then they have 5 houses available for families. And of course, we are now into day 7 of October, so they've been in this a week, and of course they are full because the need is much greater than the resource that we can put to it. But at least there is a place. Any family that comes into that center will receive not only a master case manager, but which is really important. Another part of Dr. Marvitt's recommendation is that we move from agency focused on themselves and what their agency provides, but rather work as a system. What do all of the agencies collectively do? And let's be sure that we don't duplicate services so that resources aren't scarce resources aren't spent wisely, but that they're coordinated. And so as a family is entering that system, whether they stay in the shelter or whether they receive one of the supportive houses, which is a little bit more long-term, whether or not they receive a hotel motel voucher, whether or not we're able to reunificate with a landlord, whether or not we're able to double them up with a family or friend support, no matter what their next stop is, they've now been identified for a master case manager to work across all the homeless organizations to get that family to sustainability. And the triggers of why they become homeless is very broad. It can be from domestic violence to economic job loss, because as Vallerie stated, a lot of our service industry folks, low income, working poor, cannot afford to live here. Our studies have shown that you need collectively $19.44 an hour to afford $1,000 a month rent in Sarasota County. And so if you're a single mom, that means you need 2.5 part-time jobs at minimum wage in order to just get your housing, just to get your rent. Sometimes a working couple can manage to make it, but when the relationship has issues or dissolves or there's domestic violence, then neither one of them can survive. And so that's a real issue for us. So while Dr. Marbut primarily focused on the emergency and the crisis, his 11th recommendation, which will be a long time in progress, is to establish long-term, affordable, permanent housing for folks, which of course, even beyond that, takes a livable wage in our community. And so those are huge issues that have to work. We have to work on and we'll work on for several years, but his recommendations were primarily focused off of the emergency crisis. So the intake portal's opened in North County. There's been a location identified in South County. Catholic Charities has been identified as the organization to operate that. That space is in the city of Northport's Human Services campus, where a number of social service agencies are co-located. This will be the first agency that will actually have emergency overnight sheltering in it, but it will provide direct access to the other service providers in South County. And today the County Commission approved some Office of Community Housing Development funds, some federal funds, to actually buy 5 supportive houses that are within walking distance of that social service campus to service the supportive housing component of the South County project. I mentioned a little bit about the master case management system, moving from agency focused to across the system, a system focused. And with Gulf Coast Communities Foundation, Sarasota County, we pulled the agencies together, established a 7-agency memorandum of agreement that uses common terminology, offers a workflow process for when a family comes in. So if they come into any organization that's involved, they'll get the same service and they'll get identified in master case management regardless of which agency they connect with. And so that program took off running October 1st. Our first week, we're having weekly meetings. First one's tomorrow to monitor how that's going, to make adjustments to both the intake portal and the master case management model. The other critical piece is what's called a homeless information management system. We always had a homeless information management system because with our federal dollars from HUD, we're required to. But what our agencies and the folks that have utilized that system have used it as solely as a record-keeping scorecard. So on the 29th or 30th of the month, they would count up all of their services that they provided, and they'd set it into the system on the 29th or 30th of the month, and their report would be approved so that they were able to have funding in the next cycle. And what Dr. Marbut recommended is, no, that particular information management system needs to be used by all the agencies. They need to enter their data real time so that you're not getting a free bus pass at this organization, then going to 3 other agencies and getting a bus pass and selling 3 of them on the street, so that we can utilize our resources, that we have one system. And so we've developed a plan and put together the funding necessary to provide module inputs to improvements to that system. We've increased all of the agencies that are participating in it, the agencies that signed the memorandum of agreement have all had to come online and agree to use HMIS in a real-time database and a real-time system so that they can proactively, virtually master case manage the families through the system. His other recommendation was really about critical food shortages during the summer months. Traditionally, what would happen, All Faiths Food Bank, whose primary model is to provide food to agencies. I think they have like 192 agencies that they provide food to direct clients. The problem was that every summer, after the folks who were here for the winter would leave and go north, they would get critically short on their food supply. So we had a problem with the resources available in the summertime. At the same time, with 50% of 50% of all the school-aged children in the Sarasota County school system are either on free or reduced lunch. That's 21,000 students that are, and that's 50% are on free or reduced lunch in Sarasota County. 1,000 of those are homeless every year. And so, but what would happen is during the school year, we would get them food through the school because we had access to the children. But during the summer, we had no way to access them. And so historically, All Faiths Food Banks and the agencies had issues in their distribution of the food. And they would touch about 5,000 of the 21,000 kids in the summertime. So the campaign was released, 40 Days, 40 Nights Cash and Cans campaign in April through May 10th. They had a goal of raising 500,000 pounds of food and $1 million in cash. They raised over $1.2 million in cash, and they raised 766 pounds of food, 1,000 pounds of food, excuse me. And so they now have, they're reporting releasing a report later this week that shows that the 5,000 children that they reached historically in past years, this year they reached 15,500 with the additional resources and the additional opportunities to distribute that food with the new resources. So that's that's now going to be an annual sustainable campaign. So I think that Sarasota County will become the model across really the state of Florida or the nation around getting food to kids in the summertime. And when we get food to children, we're actually supplying food for the entire family. So anyway, the other substantial complete one is Dr. Marvitt talked about a unified set of ordinances, and this is really critically tied to the adult come as you are shelter. And this was not to criminalize homelessness, because right now without any shelter, and even though we have 1,004 beds right now, not counting Vallerie's, and added those numbers in, the 1,004 beds that are available in our community are all restricted, meaning that you either have to have money to go into the program, you've got to perhaps have a substance abuse issue, you have to qualify for admission to that. Remember, Vallerie said you have to meet homeless people where they're at, not where you want them at. And so all of our agencies and all our beds are saying to homeless folks, well, once you get to where we want you, then we'll take you in. And so the adult come as you are shelter was designed to be the place where you could come in without qualification. And what that allows us to do is to have a set of ordinances that says when folks who are living in our community without a home conduct certain activities that you and I conduct in our house, could be illegal in the community, such as storage of personal property on the sidewalk, or urination or defecation in public. Those camping, outdoor camping, those things that you and all I do in our home, and it's legal, but if we tomorrow did them out in the community, theoretically one would think they would be illegal. Well, the Supreme Court has said you can only arrest for those life-sustaining activities if you provide an alternative to jail. So you can't arrest the homeless individuals for simply being homeless if you don't have another alternative for them. So Dr. Marvitt said, What we want to be able to do is provide the adult shelter so that we can have the ordinances and enforce the ordinances, not to get people to jail, because jail's the most expensive option, and they provide absolutely zero treatment or address the root cause of homelessness. So it's not a fiscally conservative way to approach homelessness, even though that's what we've been doing in a lot of cases, is to basically provide the alternative of the shelter. So we call together every municipality, the attorneys for every municipality, the state attorney, the public defender, the American Civil Liberties Union, anybody and everyone who wanted these ordinances or wanted to make sure we weren't criminalizing homelessness. We got them all into a room and said, help us draft a set of ordinances that we could give to the county commission and the city elected officials to pass as ordinances once we have this countywide come as you are facility. And so those meetings all happen, the ordinances are written, they're all ready to go. The problem is, we don't have that alternate bed yet, because the Come As You Are shelter was suspended. After several months, the city wanted to suspend that as the solution, and then the county commission followed suit after that meeting and said if we can't force it in the jurisdiction that has 75 to 80% of the problem, we can't force it in there, and so we can't move ahead on our own and do it. And so we're stepping back and taking a look and say, well, what can we do? In unincorporated Sarasota County, the county has the say. So we're working right now with the sheriff's office, the county attorney's office, to say, remember, there's 25% of adult chronic in unincorporated Sarasota County. Very much smaller number. We don't need the large shelter if we're just dealing with that population. So could we look to already existing residential beds in social service agencies, have them set aside as that alternative to allow us to have the ordinances in unincorporated Sarasota County? And could that be a role model and an example, and maybe the municipalities at one point in the future will want to join in. The adult Come As You Are shelter is on hold. Doesn't mean that our conversation over the last year was for nothing. I think it was, we've learned an awful lot. I think it will be the impetus of how we move forward. There's not political will right now to address an adult countywide Come As You Are shelter. So what I say is, apparently the problem's not big enough yet. We haven't experienced it bad enough, because the solution is a bigger problem than the problem. So until, unfortunately, we apparently have to experience the problem greater in order to have the political will to identify the solution. And so the county commission is saying, we're ready for the countywide adult Come As You Are shelter. I don't even think it's a funding discussion issue. The county commission sees this as a countywide issue. And Sarasota residents are county residents. And really, we got